The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. We'll be getting started here in a moment.
Good morning, everyone. This is Stephanie Rovito, Director of Population Health at the Pennsylvania Department of Health. I want to thank you all very much for joining us this morning for our Public Health 3.0 Winter Series webinar. Today's topic will provide an overview of the department's work around nutrition, physical activity, obesity, and wellness. With that, I will turn it over to our lead presenter, Tiffany, to introduce herself and her team.
Good morning, everyone. My name is Tiffany Branscutter. I serve as the Obesity Prevention and Wellness Section Chief here at the Department of Health. Thank you for joining us today. The team will introduce themselves as we come to their component of the presentation. So you'll be hearing from them all momentarily. So I just wanted to provide a little background on our section. We were established in 2009 in the Division of Nutrition and Physical Activity in the Bureau of Health Promotion and Risk Reduction. We are 100% federally funded. The section strives to implement equitable approaches to promote health and prevent obesity and address associated risk factors. Our current strategies are funded by the Preventive Health and Health Services Block Grant and the State Physical Activity and Nutrition Program, or SPAN grant, as I'll be referring to it today. We promote and support healthy environments and behaviors in Pennsylvania communities and in settings such as schools, child care programs, work sites, parks, hospitals, and businesses. We focus on changing policies, social and physical environments to make healthy choices easier, safer, cheaper, and more convenient, essentially making a healthy choice the easy choice. The Preventive Health and Health Services Block Grant provides all 50 states, the District of Columbia, 2 American Indian tribes, and 8 United States territories with funding to address their unique public health needs in innovative and locally defined ways. This program gives grantees the flexibility to use funds to respond rapidly to emerging health issues and to fill funding gaps in programs that deal with the leading causes of death and disability. The SPAN program, funded by the Centers for Disease Control and Prevention, supports state investments to improve nutrition and to support safe and accessible physical activity. Pennsylvania is one of 16 states awarded the SPAN grant, which the department will receive each year through 2023. SPAN will help with efforts to increase the availability of healthy foods in hospitals and community settings, breastfeeding support in birthing facilities and communities, places that implement community planning and transportation interventions to support safe and accessible physical activity, and implementation of nutrition and physical activity standards in early care and education systems. So I'm sure as all of you are well aware, obesity is a complex chronic disease. Obesity results from a combination of causes and contributing factors, including individual factors such as behavior and genetics, and external factors such as community environment. Behaviors include dietary patterns, physical activity or inactivity, medication use, and other exposures. Additional contributing factors in our society include the food and physical activity environment, education and skills, and food marketing and promotion. Our nation's increase in obesity is also influenced, as I mentioned, through a person's community. Where people live affects their ability to make healthy choices. People and families may make decisions based on their environment or community. For example, a person may choose not to walk or bike to the store or to work because of a lack of sidewalks or safe bike lanes or trails. It can be difficult for children and parents to make healthy food choices and get enough physical activity when they are exposed to environments that do not support healthy habits. Places such as child care centers, schools, or communities can affect diet and activity through the foods and drinks they offer and the opportunities for physical activity that they provide. Other community factors that affect diet and physical activity include the affordability of healthy food options, peer and social support, and policies that determine how a community is designed. Community, home, child care, school, healthcare, and workplace settings all influence people's daily behaviors. Therefore, it is important to create health environments in these locations that make it easier to engage in physical activity and eat a healthy diet. Obesity is a serious health concern because, as we know, it is associated with the leading causes of death in the United States and worldwide, including diabetes, heart disease, stroke, and some types of cancer, in addition to poor mental health outcomes and reduced quality of life. This series of slides shows the increase in obesity prevalence in Pennsylvania between 2002 and 2016. So as you can see, those regions are, as they darken, shows the increase in obesity prevalence across our state. Pennsylvania now has the 24th highest adult obesity rate in the nation, and Pennsylvania adult obesity rate is currently 32%, up from 20% in 2000 and 13.7% in 1990. In Pennsylvania, an average of 1 in 3 children in grades K through 12 has overweight or obesity, according to our Pennsylvania school district data. During the 2015-2016 school year, 34% of children screened in grades K through 12 were either overweight or obese. For children between kindergarten and 6th grade, the rates of overweight and obesity hasn't changed since the 2008-2009 school year. However, the rate of obesity has increased slightly for those in grades 7 through 12. Childhood obesity is a serious problem in the United States, and it's putting children and adolescents at risk for poor health. And certainly Pennsylvania is not immune to that. Children who have obesity are more likely to become adults with obesity, and adult obesity is associated with the risk factors and serious health conditions that we previously mentioned. And if children have obesity, their obesity and disease risk factors are likely to be more severe in adulthood. I wanted to spend a little bit of time talking about disparities. While rates of overweight and obesity have increased among people of all ethnic and racial groups, ages, and genders, some groups are disproportionately affected. Among Pennsylvania adults, Hispanic and Black populations have substantially higher rates of obesity than white populations. This map, which we call our obesity prevalence and risk map, shows our 35 priority counties, which are depicted in the 2 darkest shades of blue. Those are the counties that we've assessed as having the highest risk and with the greatest needs in terms of obesity prevalence and risk. Priority counties were selected based on an obesity risk and prevalence analysis. And to define priority geographic areas and target populations for the SPAN grant, an overall risk and prevalence and risk score was assigned to each Pennsylvania county using current data sets, including health disparity risk data, adult obesity prevalence, childhood obesity prevalence, physical inactivity and physical activity access, poverty, the Black and Hispanic populations, and breastfeeding initiation rates. And then the percentages that we assigned to each of these data sets was risk ranked with the state utilizing a scale of 1 to 10 assigned by the Jenks optimization methodology. This analysis identified, again, the 35 highest need counties, which are prioritized for SPAN strategy implementation. We plan to update this analysis likely every 2 years. Therefore, it's important to note that these priority counties may change over time. So in terms of the SPAN grant, there are 4 primary strategies that we are required to implement across the state and at local levels between the dates of September 30th, 2018 and September 29th, 2023. Excuse me. They include implementation of food service guidelines in community settings and work sites, implementation of maternity care practices in birthing facilities to support breastfeeding, implementation and integration of nutrition and physical activity standards in early care and education systems, and implementation of community planning and transportation interventions that support safe and accessible physical activity. And you'll be hearing more about these strategies as we move along in the presentation today. Addressing obesity as a public health priority is a common goal that we share with all Public Health 3.0 regional collaboratives. Through SPAN, the department plans to share evidence-based practices, lessons learned and outcomes, opportunities to scale strategies, communication messages, provision of technical assistance to Public Health 3.0 county coalitions throughout this 5-year period. We also want to engage in dialogue with local coalitions to inform our approach, identify opportunities for collaboration, and to learn from your expertise. In the next few weeks, you will receive an invitation to join the SPAN Communication Hub. Your coalition can elect to engage in receiving SPAN updates and funding opportunities. We will also continue to engage coalitions by presenting SPAN updates at regularly scheduled Public Health 3.0 meetings and webinars. And we are also interested in opportunities to have similar dialogue at local coalition meetings. At this time, I'm going to turn it over to Kim Mahaffey to talk about the food service guideline and breastfeeding strategies.
Thank you, Tiffany. Good morning, everyone. As she said, my name is Kim Mahaffey, and I oversee 2 SPAN strategies that I'm going to cover for you today. The first is food service guidelines. So this is one of the 5 SPAN strategies that we are required to work on. We are looking to increase the number of places that implement food service guidelines, and the targeted settings include both worksite and community settings. Implementing food service guidelines will ultimately increase the availability of healthy foods. Preventable chronic diseases such as type 2 diabetes, cardiovascular disease, and overweight and obesity are on the rise and can be related to poor quality diet. The federal government releases the dietary guidelines for Americans every 5 years. Data shows us that Americans are eating too much of the foods that put their health at risk, such as foods high in sodium, sugar, and saturated fats. But in addition to eating too much of the unhealthy food, Americans are not eating enough of the food that's considered to be of high nutritional value, such as whole grains, lean protein, and fruits and vegetables. While the dietary guidelines recommend filling half your meal plate with fruits and vegetables, we know that in Pennsylvania, when we gather data through the Behavioral Risk Factor Surveillance Survey, adults in 2015, only 15% of adults actually reported meeting standards of having 5 or more fruits or vegetables per day. In 2017, the most recent data that we have, that number actually decreased, so it went from 15% to 8%. Through this food service guideline strategy, we can work with work sites and community settings to not only have healthier options available to consumers, but we also need to work to promote those healthier options so that they're more likely to choose them. In order to implement food service guidelines, we'll be using 2 important guides to inform our work. If you're interested in learning more, you can look up CDC's Smart Food Choices, How to Implement Food Service Guidelines in Public Facilities, and also the Department of Health and Human Services Food Service Guidelines for Federal Facilities. We are using the Good Food Healthy Hospitals initiative to promote the implementation of food service guidelines in worksite settings. Good Food Healthy Hospitals began in Philadelphia. With SPAN funding, we're now supporting the program in Philadelphia and scaling the initiative statewide, working in partnership with the Philadelphia Department of Public Health and the Common Market. Good Food Healthy Hospitals has 16 Philadelphia hospitals representing 6 health systems participating, but now with the addition of the SPAN funding, as well as leveraging support from our Preventive Health and Health Services Block Grant funding, we will then expand by 2 hospitals in Philadelphia and 2 health systems outside of Philadelphia during this first year. We'll also be expanding further to more hospitals and health systems statewide in subsequent years as well. In this program, hospitals develop voluntary nutrition standards and identify regional procurement practices to promote a culture of health through food served in 5 areas: patient meals, vending, purchased foods, catering, and cafeteria. So while I discussed that Good Food Healthy Hospitals is considered a worksite initiative, it very much also will improve the food environment for the community, as it's going to be reaching patients and visitors as well. Good Food Healthy Hospitals provides technical assistance and resources to hospitals to implement healthy changes. Some of those changes can include increasing offerings of fresh fruits, vegetables, and nutritionally dense foods, reducing unhealthy fats and sugar-sweetened beverages, improving signage to promote healthy options, and providing nutrition information to consumers. Another piece of the food service guidelines work that we will be implementing looks specifically at community settings. In partnership with the Erie County Department of Health, we'll be assessing parks, government buildings, recreation facilities, and other areas on their current food service environment, revise and create policies as needed, and propose food service guidelines in venues, which include cafeterias, concession stands, meeting rooms, and vending machines. That's a summary of the work we'll be doing with food service guidelines, so now I can tell you about the next SPAN strategy. As Tiffany said, another required SPAN strategy is to implement interventions supportive of breastfeeding in at least one area. One of those areas is in birthing facilities by implementing supportive breastfeeding interventions in maternity care practices. Another area is continuity of care or community support. And the third is workplace compliance with the federal lactation accommodation law. While just one area is required with SPAN funding, we will be looking to address all 3. The CDC Breastfeeding Scorecard provides current data on national and state breastfeeding rates. The latest report card, released in 2018, reports on maternal recall of the breastfeeding of children born in 2015. Pennsylvania reports breastfeeding rates at slightly higher than the national averages. 83.8% of all PA babies had been breastfed at some point. 59.2% were still breastfed at 6 months. It's important to note that the American Academy of Pediatrics and other leading health organizations recommend that babies are exclusively breastfed through 6 months. However, only 25.6% of PA babies were exclusively breastfed at 6 months. We know that disparities exist among babies who are breastfed. Looking at Pennsylvania's breastfeeding data over the past 3 years, white infants are the most likely to be breastfed at 81.6%, Hispanic at 79.5%, and Black at just 74.4%. In all breastfeeding programming that we do, we want to see how we can help to close that gap by targeting communities of color. There is research which suggests that breastfeeding may help to reduce the obesity risk. Researchers are still examining why that may be, but we know that breast milk has all the nutrients, calories, and fluids that a baby needs to be healthy. Leading health organizations recommend that babies are breastfed until they're at least 12 months old. Breastfeeding also helps mom burn more calories, which may help her lose the weight she gained during pregnancy. Healthy People 2020, the U.S. Surgeon General's call to action, and the White House Task Force on Childhood Obesity all support breastfeeding and put forth recommendations to guide state efforts to improve breastfeeding outcomes. In order to increase the number of places that implement supportive breastfeeding interventions to address maternity care practices in birthing facilities, We have partnered with the Department's Bureau of Family Health and the Pennsylvania chapter American Academy of Pediatrics to implement the Keystone 10 initiative. Keystone 10 began in 2015 with our Bureau of Family Health as a quality improvement program that engages Pennsylvania birthing facilities in efforts to improve the protection, promotion, and support of breastfeeding. Keystone 10 participants include 86 of Pennsylvania's 93 birthing facilities, which impacts 98% of the births in Pennsylvania. Participating facilities work through the completion of 10 steps, which are based on the nationally recognized World Health Organization and the United Nations Children Fund evidence-based 10 steps to successful breastfeeding. To date, 15 facilities participating in Keystone 10 have completed all 10 steps. And on the next slide, I'll show you what those 10 steps are. If you work in the breastfeeding world, these should look very familiar to you. Participating birthing facilities complete an application for each of the 10 steps, which provide data and information on how they're meeting the requirements of the step. If a facility is designated as baby-friendly, which is a nationally recognized certification program, that facility then qualifies to be Keystone 10 designated, as they would have also had to meet similar step requirements. Keystone 10 has many other components to meet the birthing facility's needs and to improve breastfeeding support. The initiative provides a 15-hour educational curriculum to participating facilities, which helps to address Step 2 requirements. It's a free training that's aimed at nurses. Keystone 10 provides technical assistance and resources. They maintain a web-based communication platform, which is very active and a source of communication for participants to ask questions and hear what other facilities are doing. The initiative also holds regional collaborative meetings. The meetings bring together participating birthing facilities in each of the 5 breastfeeding regions and are structured to provide Keystone 10 updates, presentations by experts, and breakout roundtable discussions on breastfeeding topics. The facilities find the meetings especially useful to share resources, challenges, and successes with each other. Keystone 10 also holds webinars to continue education and communication with participating facilities. Leveraging funds from our Preventive Health and Health Services Block Grant, Keystone 10 is convening a statewide breastfeeding summit this year for participating facilities for an entire day of education and collaboration. To improve breastfeeding interventions in continuity of care and community settings, we are offering the American Academy of Pediatrics training known as EPIC BEST. The 1-hour quality improvement training aims to improve breastfeeding support through community-based primary care practices such as family medicine, pediatrician offices, and OBGYN practices. The training provides the latest information on breastfeeding support and data. We are currently working to transition this training from in-person to web-based. To address the workplace compliance with the federal lactation accommodation law, we are looking to improve the department's promotion and support of breastfeeding to its employees. The federal law requires that workplaces provide a place other than a bathroom that is shielded from view and free from intrusion from coworkers and the public, which may be used by an employee to express breast milk. Healthy People 2020 includes a goal to increase the proportion of employers that have worksite lactation support programs. In 2018, almost half of employers provided a separate on-site lactation room or mother's room. While the Department of Health meets the minimum requirements and beyond, we are looking at ways that we can expand the support of moms who are expressing breast milk to promote the longevity of breastfeeding among department employees. That's all I have for the breastfeeding strategy. So now we can move on to talking about our third strategy.
Thank you, Kim, for that great information about food service guidelines and breastfeeding. Good morning, everyone. My name is Tiffany Ricci, and I'm the Program Administrator for the Department of Health's Childhood Obesity Prevention Program. I'm going to give you an overview of the Early Care and Education, or ECE, strategies in the SPAN grant. So first, I'd like to give a little background to explain why ECEs are important in the context of childhood obesity. I'm sure you're all aware that childhood obesity is an epidemic in the United States and here in Pennsylvania. childhood obesity rates have more than doubled over the past few decades, and the percent of children with obesity increases from age group to age group. For example, the 2018 State of Obesity Report shows 14.5% of Pennsylvania children aged 2 to 4 had obesity, and the percent of children aged 10 to 17 with obesity is 16.8%. So nationally, that ranks Pennsylvania 14th among 51 states and the District of Columbia, meaning that only 13 states have higher childhood obesity rates than we do. So clearly, childhood obesity is a great concern in our state. It presents a major threat to children's health because obesity is associated with a number of health risks, including high blood pressure, high cholesterol, type 2 diabetes, sleep disturbances, and orthopedic problems, but also social and psychological problems, such as bullying and poor self-esteem. It also costs the United States healthcare system an estimated $147 billion a year. Therefore, early care and education is a critical setting for obesity prevention efforts. We know that 60% of 3 to 5-year-olds are cared for in an ECE facility at least once a week. So those facilities can directly influence what children eat and drink and how physically active they are, as well as build a foundation for healthy habits that they can carry into adulthood. So there are 2 strategies in the SPAN grant for ECEs, one for nutrition standards and the second for physical activity standards. Our activities address both simultaneously, so you'll hear me refer to nutrition and physical activity standards and obesity prevention efforts interchangeably as I talk about our work. The SPAN activities are 2-pronged. First of all, working on policy, or what I'm going to refer to as sort of the big picture, and second, implementation, or the boots on the ground work actually with the early care and education providers themselves. So for the policy piece, we're working with a statewide group of ECE stakeholders through the Keystone Kids Go, or KKG work group, to embed nutrition and physical activity standards in state systems like quality ratings improvement, or what's known as the Keystone Stars, state professional development systems, licensing, statewide technical assistance networks, state subsidy programs, statewide recognition programs, and others outlined in CDC's spectrum of opportunities. The spectrum outlines how the previously listed state ECE systems can embed recommended standards and best practices for obesity prevention, and also provides worksheets and tools to be used to identify those opportunities. So through preliminary work with the Departments of Education and Human Services and Keystone Kids Go members from the Head Start State Collaboration Office, the Pennsylvania American Academy of Pediatrics Early Childhood Education Linkage System, or EXCELS, the Office of Child Development and Early Learning, OCDEL, Penn State Better Kid Care, Penn State Cooperative Extension, Pennsylvania Family Literacy, the Pennsylvania Nutrition Education Network, and the Tuscarora Intermediate Unit, we've identified 2 state system opportunities. The first is to establish a protocol that ensures statewide technical assistance networks that will be provided through OCDEL's early learning resource centers, receive training in order to use up-to-date resources and assist providers in meeting nutrition and physical activity standards. And the second is working with the Pennsylvania Department of Education to implement nutrition standard content into CACFP, or the Child and Adult Care Feeding Program, infant feeding module, specifically around breastfeeding and focusing on breastfeeding. So that describes the policy part of our work. Now I'll talk a little bit about the implementation. Using the Pennsylvania Nutrition and Physical Activity Self-Assessment for Childcare tool, or the PA NAPSAC, which is a web-based continuous quality improvement intervention, we partner with the Tuscarora Intermediate Unit, TIU, to help childcare providers improve nutrition and physical activity practices and policies in early childcare settings. So PA NAPSAC is based on the continuous quality improvement model, which is 4 steps: assessment, action planning, implementation, and evaluation or reflection. Early care providers receive training and technical assistance to build their capacity to apply this model in the planning and application of activities that align with national standards for obesity prevention in early childhood. So each year in the fall, we recruit applicants to participate in the PA Knapsack mini grant program. By leveraging our block grant funding and using SPAN funds, we are able to support 100 centers. They each receive a $500 mini grant as an incentive to participate. But our surveys of past participants tells us that they actually value the technical assistance and resources that they receive more than the money because the mini grant program is very technical assistance heavy. So TIU provides technical assistance for the continuous quality improvement process and guides the centers through PA Knapsack. And sites receive additional technical assistance specifically to help with implementing activities and developing policy to support nutrition and physical activity changes. And this hands-on technical assistance is provided by the Pennsylvania chapter of the American Academy of Pediatrics Early Childhood Education Linkage System, or EXCEL's Child Care Health Consultants. And they do this via phone, email, and a number of in-person visits to a select number of sites. So because the centers receive so much support from TIU and the Child Care Health Consultants, we have a successful completion rate of over 85% each year. So now I will turn things over to Tiffany Branstetter, who will be presenting the community physical activity strategy.
Thank you, Tiffany. So I do want to add that Justin Lehman, who's enjoying some time away, is the Public Health Program Administrator that leads our physical activity strategies. So I'll be presenting his material, but I certainly wanted to give him credit for these slides and the work he does every day. So we know that regular physical activity helps to improve overall health and fitness and reduces the risk for many chronic diseases. In fact, getting enough physical activity could prevent 1 in 10 premature deaths, 1 in 8 cases of breast and colorectal cancers, 1 in 12 cases of diabetes, and 1 in 15 cases of heart disease. However, we also know that 1/4 of Pennsylvania adults have reported that they are not at all active in their daily lives. All right, so the State Physical Activity and Nutrition Programs, or SPAN, addresses community physical activity through 2 main initiatives. The first being connecting transportation with key community locations or destinations through planning and land use interventions. And then second, establishing new or improved direct and convenient connections with everyday destinations that are both safe and easily accessible. When we think about connecting transportation with key community locations or destinations, this could include connecting sidewalks, paths, bicycle routes, public transit with homes, early care and education, schools, work sites, parks, or recreation centers through the development and adoption of master transportation plans and/or land use interventions. Further, SPAN looks to expand on that connection through the development of new or improved activity-friendly routes, which can be defined as a direct and convenient connection with everyday destinations. This might include crosswalks, protected bicycle lanes, multi-use trails, and pedestrian bridges. To sum it up in one sentence, designing streets and communities so all modes of transportation, the pedestrian, bicyclist, transit user, and motorist, can interact safely and convenient on a daily basis. So just thinking about why we need to design our streets and communities so all modes of transportation can interact safely and conveniently, there are a host of reasons why. It determines what we have and don't have access to. Safety. Injuries sustained from car crashes continue to remain the leading causes of death for people ages 15 to 24. Air quality. Air pollution is the leading cause of heart and lung disease. So reducing the number of vehicles on the road or the miles traveled can improve air quality in our communities. Access equity. According to the 2017 National Household Travel Survey, nearly 9% of households do not have a vehicle. Without public transportation and bike and pedestrian infrastructure, people without a car may not be able to access places and services such as healthcare facilities, grocery stores, schools, and parks. And the one that we primarily focus on is physical activity. Transportation infrastructure that focuses on active modes of transportation can encourage and allow for regular physical activity in our communities. According to the 2009 National Household Travel Survey, 50% of all trips in the United States are less than 3 miles. 28% of trips are less than 1 mile. However, 60% of these trips are also driven. So there's a tremendous potential to convert short trips from driving to an active mode of transportation, such as walking, biking, or using public transit. To address the high rate of obesity and increase the number of individuals that are engaging in some type of physical activity on a more daily basis, we created WalkWorks. WalkWorks is a collaborative program between the Pennsylvania Department of Health and the University of Pittsburgh Graduate School of Public Health, and it focuses on increasing opportunities for physical activity in Pennsylvania communities. Through an application process, nonprofit organizations and municipal entities are invited to become a WalkWorks affiliate partner. These partners will work along with other community stakeholders to develop an appealing 1 to 2 mile walking route, including points of interest. Through a separate application process, municipalities, metropolitan and rural planning organizations, and other similar types of organizations are invited to apply for funding for the development of transportation plans that emphasize walking and biking, and/or develop and adopt policies that include language and support of environmental changes for enhancing places for physical activity with an emphasis on walking. While community design has long been the domain of land use and transportation planners, it has become increasingly obvious that communities will benefit from greater collaboration of public health practitioners and municipal planning entities and other partners to create built environments that better support health. These WalkWorks programs will specifically target SPAN priority and Public Health 3.0 counties. As I share a little more about them, I would encourage you to think about your community, communities that you work with, or your network of partners that you could share this information with. Selected affiliate partners receive technical assistance from the University of Pittsburgh Graduate School of Public Health on the development of their walking route. Partners also receive opportunities to learn from the experience of partners already engaged in the program. They receive promotional material, signage, and group emails, newsletters, and useful webinar announcements, and educational materials that, among other things, connect health and transportation. Partners are provided with technical assistance and resources to help ensure the sustainability of the program. Once the community partner develops the walking route, promotional brochures are printed to help with promotion of the walking route. These brochures include several resources, including a map of the walking route and points of interest along the route. I wanted to draw your attention to some of the things that we like most about this particular WalkWorks walking route in Easton, Pennsylvania, which is in Northampton County. This walking route encompasses so much of what WalkWorks is about. It provides connectivity to vital community destinations, including a neighborhood center that provides programs and services to address poverty, homelessness, and hunger, the former Stewart Silk Mill, which is in the early process of being converted to apartments and possibly retail spaces, a place of worship, a community park, and an elementary school. The WalkWorks Affiliate Partner Program is all about connecting key community destinations and highlight how many times they are closer than we think. The flip side of the map provides a short write-up of the 5 points of interest in the community. So I want to transition to highlight our funding for the development of transportation plans that emphasize walking and biking and/or development and adoption of policies that include language in support of environmental changes for enhancing places for physical activity with an emphasis on walking. The first 4 communities that received funding from November 2017 through June 2018 included Elizabethtown Borough in Lancaster County, Jersey Shore Borough in Lycoming County, Oakmont Borough in Allegheny County, and West Earl Township in Lancaster County. All 4 of these communities developed and adopted some type of active transportation plan or made enhancements to existing plans. And just last month, we selected 11 new communities to receive grants that will assist them with the development of active transportation plans and policies through September of 2019. Since 2014, we have developed and implemented 89 walking routes in 21 counties. This map shows the location of all 89 routes with the red dots, as well as the communities that have adopted plans and policies such as Complete Streets or Vision Zero. Several WalkWorks partners are also integral parts of Public Health 3.0 in their region. So we couldn't do this without partnerships. Partnerships certainly enhance this work, and we have key partnerships with our sister agencies, the Departments of Conservation and Natural Resources and Department of Transportation. We have memorandums of understanding with both agencies in support of our SPAN efforts. And this includes work to identify funding to support active transportation plans and policies, and to share information related to grant applications that request funding for bike and pedestrian improvements, and also to participate in meetings related to active transportation. While our funding allows us to increase community capacity to ensure safe and accessible physical activity, specifically with PennDOT, we're hoping to identify opportunities to provide an advantage to communities who adopt inclusive master transportation plans and those that have supportive policies to obtain funding for planning and infrastructure improvements in their community to support implementation of those plans and policies. A request for WalkWorks affiliate partner applications will be made in March 2019. A request for WalkWorks funding for the development of active transportation plans and policies will be made available this summer. Like I mentioned earlier, these WalkWorks programs will specifically target Public Health 3.0 counties and our SPAN priority counties. We will need your help to promote them, and we're hoping that you'll consider sharing them with your network of partners. Next, we'll hear from Jackie Williams on the SPAN evaluation.
Thanks, Tiffany. So again, this is Jackie Williams. I coordinate the evaluation for SPAN. The definition of evaluation is systematic investigation of the merit, worth, or significance of an object. But what does that mean in terms of public health program? Since SPAN is a 5-year program, it's important that we don't wait until the end of the 5-year period to know if it worked. We want to create a plan up front to evaluate whether it's working and make improvements as we go, based upon data we collect along the way. Using the analogy of a garden, good evaluation broadens our focus. Rather than waiting to see the crop yield at the end of the growing season, it makes sense to gather data on whether the crop is being sufficiently watered, whether blossoms have appeared, is there any evidence of pests. This enables us to take corrective action and also to reinforce methods that are working well. For public health programs, this data would include key information such as location of activities, types of activities, program reach, and outcomes for the purpose of showing the program's ability to target and reach our priority populations throughout Pennsylvania. To accomplish this, we use the evaluation framework. Adhering to the steps and standards of this framework will generate an understanding of each program's context and will improve how we plan and conduct our evaluation. The emphasis is on a practical, ongoing evaluation of strategies that involve all our program stakeholders, not just the evaluators. The standards shown in the middle of the framework are used as the criteria for judging the quality of programs' evaluation efforts in public health. No matter what the evaluation plan looks like, the best option is to maximize these 4 standards at each step of the way. The first, utility, by collecting practical data elements and sharing this data to inform timely improvements in outreach, services, training, and technical assistance. Feasibility, by using mixed methods of data collection to best manage time and costs without overburdening any one stakeholder group with feedback responsibilities. Accuracy, by organizing key measures so repeated measurements can be taken over time. And finally, propriety, by implementing a mixed method, mixed source evaluation plan and protecting stakeholder anonymity as appropriate. To organize and plan our approach, a logic model is created to make this process much easier. It is essentially a roadmap that presents the shared relationships among the resources, activities, and the desired outputs, outcomes, and impact for each public health program. In addition, we include indicators. Indicators are specific, observable, and measurable accomplishments or changes that indicate whether our programs are on track and will ultimately achieve the intended health impact. As we progress over the 5-year funding period, there are several core areas of focus that build upon each other that we will be evaluating. This will begin with a look at our approach and then progress through an evaluation of our efficiency, effectiveness, sustainability, and lastly, our impact. Through the use of the logic model, identified evaluation core areas and questions, and indicators, an evaluation plan can effectively be developed. A typical evaluation design is shown here. For SPAN, we will also be including our plans for disseminating the results, since this is an important aspect of the grant. For SPAN, the department is contracted with PHMC, the Public Health Management Corporation. They will be analyzing the data that is collected and reported by SPAN partners, sharing the results and lessons learned with the department, CDC, and program partners, and providing feedback on program successes and areas for improvement. Through these evaluation efforts, we ensure that our SPAN funding has the best opportunity to improve health outcomes throughout Pennsylvania, particularly in our priority populations.
Thank you, Jackie. We want to thank you for your participation in today's webinar. We hope that this introduction to SPAN provided you with an understanding of the SPAN strategies and our approach. Your local coalition can help to identify health systems to scale good food, healthy hospitals, and promote PA knapsack and WalkWorks funding and professional development opportunities. We hope that you will partner with us to share SPAN communication messages. We will share messaging intended for public and partners. The goal of these communication messages is to engage, inform, and educate communities of SPAN activities. Communication can also impact awareness, knowledge, attitudes, and behaviors of individuals and groups to encourage new perspectives and approaches to make healthy living easier. These messages will be shared on our SPAN Communication Hub. In the next few weeks, you will receive an invitation to join the SPAN Communication Hub. We will utilize the hub to engage partners and share communication messages, SPAN updates, and funding opportunities. We will also continue to engage coalitions by presenting SPAN updates at Public Health 3.0 meetings. And as I mentioned previously, we are also interested in opportunities to have similar dialogue at local coalition meetings. Again, I thank you for your participation, and we will now be opening the call for Q&A. If you connected via telephone, we will unmute now, but please self-mute your phone until you are ready to ask a question to keep the background noise down. And if you are connected solely through the computer audio, you will need to unmute yourself prior to talking. When you ask a question, please state your name, the organization you're affiliated with, and the county. I think we are ready. Any questions? We'll give a few more moments for any questions. I will note that this webinar is being recorded and will be available on the SPAN Communication Hub, and we will also make the slide set available there as well.
Hi, this is Lisa Davis. Can you hear me now?
Yes. Hi, Lisa.
Okay, great. Hello. I was talking away, but I think I was still muted. Just for anyone's knowledge, I think you have to press *6 in order to be unmuted, because I don't think they unmuted all the lines. So I'm with the Pennsylvania Office of Rural Health, and my office is located in Center County. And I wanted to let you know that in looking at the map that you put up at the beginning of the presentation, it looks like a lot of the counties that you want to target are rural counties. And some of them have hospitals in them that we work very closely with. So as you get information together that you want to send out, we'd be very happy to be on that distribution list and let our hospitals know. Many of them are working very hard to make the switch from volume to value, which includes being able to connect with their communities and do some new and innovative programs. So we'd be very glad to be part of that.
Lisa, thank you. We would certainly appreciate that, and that's exactly for the type of connectivity that we're seeking through partnering with all of you. So again, thank you for sharing that, and we look forward to working with you.
And if at some point you'd like to have a conference call with our staff, especially our quality improvement coordinator here, we'd be really glad to do that, because that's a way for us to get information out to at least 25, if not more, hospitals.
Great, thank you. Any other questions or comments? Again, as Lisa reminded us, please unmute yourself by hitting *6. Okay, well, hearing no further questions or comments, again, thank you for your participation. You do have our email addresses and contact information available on the slide. It looks like there might be a comment or question coming in.
Oh, here's a question. Will the PowerPoint be available for download?
Yes, the PowerPoint will be available on the SPAN Communication Hub for download. Is that everything?
There might be one more. Say at one of the new counties for intervention.
Yeah, so someone asked if Fayette County was a priority county, and yes, Fayette County is a priority county for intervention. It was actually the county with the highest need in terms of our ranking. So it is a priority county for SPAN. Any others?
That's all I can see.
Okay. We're just making sure that there are no other questions in the Q&A chat box. No? Okay. I think we're good. If we missed anything, we can. There's one more? Okay, another question came in.
Is Blair County a priority county?
Is Blair County a priority county? I can tell you here in a moment. Yes, Blair County is one of our SPAN priority counties. Anything else, Jackie? Okay. All right. Well, if we've missed any Q&A in the chat boxes, we'll be sure to get that up and available on the hub as well. All the Q&A has been recorded on the webinar, and so that'll be available on the recording link that will be distributed. And certainly feel free to reach out to us if you have any additional questions, or if you'd like to have discussion with us in the interim. Again, you can look forward to hearing from us via email with an invitation to join the SPAN Communication Hub in the next few weeks. Thank you again for your participation, and have a great day.